everyone. Welcome to assignment 2, UNISA PYC 3702. It's horribly long, so I hope we can get through it fast enough. Let's go. There are 3 things we're looking at. 1, personality disorders, well, actually 4. Personality disorders, impulse control disorders, a little part, then childhood disorders, and then neurological disorders. Not neurological, neuropathological. We'll get to it. All right. There are 10 personality disorders that we cover. 3 fall into the odd or eccentric cluster. That's paranoid, schizoid, schizotypal. Then we've got dramatic, emotional, erratic. We've got 4 in there. So that's where we've got our villains. We've got our narcissistic personality disorder and our antisocial personality disorder. But we've also got histrionic and borderline in there. Then the 3rd cluster is the anxious and fearful. We've got avoidant, dependent, and obsessive-compulsive personality disorder. Okay. Right, what is a personality disorder? It is a dysfunctional and maladaptive personality pattern that's long-term and present in nearly all situations. It results in impairment of self and interpersonal functioning. It involves behavior, thoughts, emotions, and interpersonal functioning. Inflexible, deviates from cultural expectations, evident from adolescence or early adulthood, and stable over time. They can be treated and they can be ameliorated and brought into minimal harm or even cured, but this is a long-term process and highly skilled. It's not always easy. Okay, there's approximately, we're not sure, but perhaps 10% up to 15% of the population has a personality disorder. So it's quite a lot of people. Not all personality disorder types seek help. So we're not really sure. Okay, there's 2 ways of categorizing it or diagnosing it. One is through the category model, which we're going to use today because it's so nice and simple and clear. And the other is the dimensional stroke categorical assessment. Okay, so we'll look at why we use that later on. Let's go through the odd eccentric. Paranoid, schizoid, schizotypal. Typal. Okay. Paranoid. Pervasive distrust and suspiciousness of others and seeing their motivations as malevolent. Such a person will tend to be often withdrawn and aloof, very resistant to change, very seldom do such people seek help, seems to be slightly more common in males. Tends to be rigid and preoccupied with unfounded beliefs.
Еще раз обращаюсь к военнослужащим вооруженных сил Украины. Не позволяйте неонацистам и бендеровцам использовать ваших детей, ваших жен и стариков в качестве живого щита. Берите власть в свои руки. Похоже, нам с вами будет легче договориться, чем с этой шайкой наркоманов и неонацистов, которая засела в Киеве и взяла в заложники весь украинский народ.
Okay, schizoid personality disorder. Here we have Professor Snape. Pervasive detachment from social relationships and a restricted range of emotions in interpersonal settings. Social isolation, emotional coldness, indifference to others. Do not desire or enjoy close relationships, often living alone, solitary hobbies, withdrawn and reclusive. Relationships are superficial and frequently awkward. Slightly more common in males, possibly up to 5% prevalence in the United States.
Did you ask a question?
I was just curious if you have friends, people maybe that you like to do things with?
Yeah, this guy that I used to work with me in the factory when I wasn't working. I'd sometimes see him fishing.
What people have been special to you?
No one really.
Okay, Schizotypal personality disorder. Odd, eccentric. So this is similar to the schizoid, but more odd and eccentric with stranger thoughts. Okay, may believe they possess magical abilities and superpowers. Some are subject to recurrent illusions, often have speech oddities, such as frequent elaboration, digression, or vagueness in conversation, high social anxiety, slightly more in males and females. Both schizoid and schizotypal are associated somewhat with schizophrenia. It's like a spectrum. Schizophrenia is more of the extreme. Okay.
And I often knew what he was thinking, so I knew when to leave him alone.
Where is he?
He died.
When was that?
A few years ago.
How did that happen?
I don't know. I read about it in the alumni magazine. But I remember receiving a feeling that something had happened to him before I read it.
Okay. Antisocial personality disorder. Our villains. Pervasive pattern of disregard for and violation of the rights of others. This diagnosis only applies from the age of 18. Older, younger is conduct disorder. Lack of anxiety and guilt, irresponsible behaviors, shallow and superficial affect, little concern for wrongdoing, manipulative, lying, aggressive sexual acts, seek power over others. So psychopaths and sociopaths both fall into the antisocial personality disorder. There's low levels of anxiety and fear, often a bold interpersonal style, and high levels of attention seeking. Nearly 5% prevalence in the United States at the top level of the spectrum, which is 1 in 20 people. That's quite a lot. Many more males than females.
Sorry, what does this have to do with your arrest?
I'm trying to tell you, if you let me finish. Okay, so I have to go get some cash from my mom's house. She's watching out for my baby. I got to say hello to him, bounce him on my lap, let him know I still love him, and then I got to go get that bike by Tuesday. 3 days. Come Wednesday, it's gone. They ain't holding it no more.
All right. Antisocial personality disorder is different from impulse control disorder, and it's also not the same as just being a gangster because everyone around you is a gangster, or civil disobedience, obviously. Okay. Borderline personality disorder. Okay, people with borderline personality disorder have volatile emotional reactions, unstable interpersonal relationships, poor self-image, impulsive responding, lack a strong sense of self-identity, and a fragile self-concept. Fluctuations in mood, volatile interactions, chronic emptiness, possibly substance abuse, may fluctuate between being friendly and hostile, and many people have suicidal behavior. It is a risk. Okay, so therefore, borderline personality disorder does need to be treated with care. Okay, sometimes psychotic syndromes, often correlation with a traumatic and difficult childhood. In other words, the borderline personality disorder and response to complex trauma is hard to distinguish and may not always be distinguishable. Okay, up to 10% suicide rate, very high. Dialectic behavioral therapy works with it, and in a careful sequence of safety and effectiveness, starting with working through the suicidal behaviors. More women than men are prone to it.
Out randomly because I didn't know what to do with it. I never dealt with anger. I never had to deal with anger. Like usually things just slid off me. About 2 weeks after my 30th birthday, I admitted myself to a psych hospital because I wanted to kill myself. It's made things hard. Because my brain was never wired right. And a lot of the things that make me funny and creative are the things that make it so I can't function in life. So it's like a blessing and a curse sort of thing.
Okay, then we have histrionic. Histrionic personality disorder, excessive emotionality, attention seeking, can be very seductive, flamboyant, flirtatious, self-dramatization, can be superficial warmth and charm, but shallow and self-centered. Not very common, the US prevalence 0.4 to 1.8. We don't know if there's a gender difference or not. Women do present more. Right, narcissistic personality disorder, our villains. Another bunch of villains. Narcissists may or may not lack empathy. It depends on the person. But there is going to be a pervasive pattern of grandiosity and a need for admiration, self-centeredness, putting themselves first, overestimating their own talents and importance. Up to from 0 to 6.2% prevalence, so 1 in 20 people, that's quite a lot. Treatment is about helping clients to perceive, understand, and relate to others as important.
How would you feel if we didn't change the appointment?
That's ridiculous. Are you refusing to change?
No, I asked if.
Well, I don't see what difference Tuesday or Thursday makes. And here I have something very important.
Sounds like you feel that at work, on dates, here with me, none of us grasp what is important for you.
Very few people can grasp what is important to me.
All right, avoidant personality disorder. This is like extreme shyness, low self-esteem, social inhibition, feeling inadequate and hypersensitive to negative evaluation. Such people really want to be part of the social connections, but find it very hard to reach out, often very socially inept. Feeling inferior, depressed, anxious, up to 1 in 20 people in the US. No gender differences.
I didn't have many friends in high school. I was never a cheerleader or part of the band or a member of choir or anything.
Why was that?
Because I never felt good enough. I knew I would never make it, so I didn't try.
Okay, dependent personality disorder, quite rare, like 1 in 200. Such people don't feel they can cope on their own, so they're totally dependent on others and lack self-confidence. So this inability to take responsibility and step out into the world as a person with your own independence can make a person with dependent personality disorder quite depressed, helpless, with suppressed anger. May seem very nice, understanding and tolerant, but ends up often in an abusive relationship because they're just not willing to make the sacrifice of leaving to make the situation better.
Can Larry come in now?
What would that feel like, talking with him?
He can talk better than I can.
Did your husband cut your arm?
Oh, I don't think he really meant to.
Has he ever hurt you before?
He never really means it. It's just when he's drinking.
Have you ever thought about leaving your husband?
Oh, I could never do that. I couldn't live without him. He's really good to us.
And how is he good to you?
He drives me to the store, and he drives me to his parents, and he takes me to his wrestling matches, and
Obsessive-Compulsive personality disorder. Very controlling, very nitpicky, inability to see the big picture, preoccupation with orderliness, perfectionism, and control. It's not the same as obsessive-compulsive disorder, which is characterized by unwanted intrusive thoughts and urges. Okay, she's very cute. She does her own role models.
I was just admiring what you have on your bookcase. Very pretty. You have a nice place here.
Right. Moving on to the second aspect, which is impulse control disorders. We're just looking at 3. Intermittent explosive disorder. When intermittently you explode with anger and aggression. You may regret it in between and not actually feel aggressive in between, but it's an overreaction to situations where you just lose your temper. Okay, kleptomania, you have this overpowering urge to steal. It's not really based on needs or practical motivations. It's just you want to steal something. Pyromania, this overwhelming urge to set fires and a fascination with fires. Again, not driven by practical considerations, but by that internal urge. Although you may still be the kind that sets fire to other people's Wendy's as a social justice technique. All right. Now, okay, we're not going to go into details about antisocial personality disorder. I do recommend looking at the wonderful James Fallon, who is a neuroscientist and a prosocial psychopath. There are issues with these wonderful clear 10 categories. People don't always fit into them. They can be masked. For example, borderline personality disorder and post-traumatic stress disorder can be very hard to distinguish. We are all on a continuum. We can all recognize ourselves in each and every one of those categories. So the dimensional model looks more at personality functioning and at specific traits. And it eliminates 4 of the personality disorder categories: paranoid, schizoid, histrionic, and dependent. Okay, right, let's look at childhood. Okay, what is normal for adults and what's normal for children are quite different, but there's about a 50% prevalence of mental disorders amongst children, and sometimes there's quite a severe risk of long-term developmental problems or suicide and so on. So it's important that they be diagnosed and treated. Okay, so you can divide childhood disorders into internalizing, which is the internal emotional effect is greater than the external, and externalizing, when everyone around them feels it more than they do. Okay, so internalizing disorders are turned inward, heightened reactions to trauma and stresses, difficulty regulating emotions. Most common disorders are anxiety and depression, which are risk factors for suicide and substance abuse. You do need to rule out sexual abuse when youngsters present with internalizing disorders. Okay, so anxiety and trauma. Phobia and social phobia are the most common. There's separation anxiety disorder, and there's selective mutism. Attachment disorders. Okay, lousy caregiving, abandonment, stress, abuse, mistreatment, inconsistency can lead to either reactive attachment disorder, in which the child withdraws and does not try to attach, stays sad and to themselves. And the other option is disinhibited social engagement disorder, in which the child will try to form close bonds with just about anyone because they're not getting that from their caregivers. The treatment is to make sure that they get proper nurturing caregiving that is consistent and helpful. Okay, post-traumatic stress disorder is the same in children as it is in adults. It's triggered by threats or direct experience with death, serious injury, or sexual violation. So you get nightmares, flashbacks, physiological reactions to triggers, play acting or rehearsing it in the mind, either reliving the trauma or totally not even knowing exactly where they are, social withdrawal, less positive emotions, losing interest in what they used to enjoy, anger, aggression, tantrums, difficulty sleeping or concentrating, exaggerated startle response, and vigilance. Okay, non-suicidal self-injury. Okay, a lot of people who are doing this kind of cutting and burning and harming of the self do go on to become suicide risks, so one must be careful. Usually there's an overwhelming urge to injure oneself, and when you do that, you feel instant calm and relief. It relieves stress and pain, and there's an aspect of emotional pain. There's an aspect of self-punishment. It does go with lots of negative cognition and negative self-talk. Usually begins in early adolescence, both genders. Mood disorders. Depression is the most prevalent, and it's in girls and older teenagers. High suicide risk, so it must be dealt with. There are both genetic and biological factors as well as environmental triggers. Okay, treatment which is evidence-based is CBT, family-focused therapy, positive psychology, and medications such as Prozac, selective serotonin reuptake inhibitors. But there are risks associated with these medications, increased risk of suicide and affecting the plasticity and neurochemical construct of the brain in the long term. Okay, disruptive mood dysregulation disorder, chronic irritability, and severe mood dysregulation, including tempers, anger, sadness, and unhappiness. Often predicts later depressive and anxiety disorders. Pediatric bipolar disorder. This is the same as adult, but it has a very poor prognosis. It's a very serious condition. It's characterized by those moments of mania, elation, elevated energy, and interspersed with either depression or normality. Externalizing disorders. These are the childhood disorders disturbing to others. So you have ODD, oppositional defiant disorder, in which the child is oppositional, defiant, angry, argumentative, and vindictive. Okay, may resolve or evolve into a conduct or depressive disorder. Intermittent explosive disorder, same as in adults. Conduct disorder. This is the same as antisocial personality disorder, but it's in youngsters. So there's deliberate aggression, including sexual assault, destruction of property, which may include setting fires, theft or deceit, serious violation of rules, often becomes more serious with age. Okay, up to nearly 10% meet the criteria of conduct disorder. Limited pro-social emotions. High risk of continuing criminal behavior and being diagnosed with antisocial personality disorder in adults. So intervention is very important. Okay, there's all sorts of reasons biologically why a person may be predisposed to conduct disorder, but then what happens is that you have a bad childhood and that locks you into it. Whereas if you have a good childhood, even with the same brain chemistry and the same genes, you may not go on to develop this condition. Okay. So there's a need for parental education, and there's a need for psychosocial interventions for the young people. Assertiveness, anger management, empathy, having mentors, and a lot of help. Okay, moving on to neurodevelopmental disorders, impaired development of the brain and central nervous system. So you've got tics and Tourette's. Tourette's is basically tics plus verbal tics, okay? Attention deficit hyperactivity disorder and autism spectrum disorders, intellectual and learning disorders, which are two very different things. So Billie Eilish has Tourette's, may include vocal tics such as coprolalia, having a strong urge to say inappropriate things. Habit reversal can help. ADHD, very prescribed, very researched, very medicated. It can be quite severe, but it can also be quite mild and does seem to have a biological base. The kid can't focus and is hyperactive. partially to do with brain development, like parts of the brain is simply underdeveloped, and nowadays children have to sit still all day at school, which does not help. There are various environmental triggers, and it may be a form of acting out in relation to family stress. Autism spectrum disorder. This is very wide. So 1/3 of the people with autism spectrum disorder are severely disabled, may not even be able to go to the toilet themselves. And half of the people with autism spectrum disorder are highly functional and can probably just live a normal life. Okay, it's 5 times more common in boys than girls. It's characterized by 1, deficits in social communication and interactions. That's eye contact, recognizing others as individuals, using people as objects, avoiding communication except about whatever you're fixated on, not listening. Okay, poor social boundaries. And the other aspect is repetitive behavior or restricted interests or activities. So you get flapping, you get spinning, or you get spinning of objects. One side, echolalia, just repeating what is said, repeating what is said, repeating what is said, with not much relation to the actual meaning. Okay, intense focus on rituals or routines, and either being very, very, very sensitive to sensory overload or completely numb to what's going on. Okay. Early and significant intervention are absolutely crucial. This is to help the brain restructure itself because the brain is plastic. So ideally you want to be diagnosed as young as possible and have as much intervention as possible. Okay. Over time, the graph of autism spectrum disorder prevalence has gone like this. So it's very likely that there's some kind of environmental trigger, such as toxins, pesticides, or something that's causing an absolute epidemic in autism nowadays, which wasn't here before. Okay, intellectual disability. Sometimes this is idiopathic, it just happens. It may be mild, an IQ of 70 or less, 50 to 70, or severe, again, profoundly disabled. The earlier and the more intervention is brought into play, the better the prognosis. The brain can develop, people can learn and develop increasing ability to have a good life. Okay, causes may be genetic problems, like a recessive genetic flaw, such as Fragile X syndrome, or it could be that the chromosomes don't come together properly when the little zygote is formed, such as Down syndrome. Okay, or it could be something that happens in the womb, such as if the mom has TB, or she's an alcoholic, or she just abuses alcohol. All of those things could cause intellectual disability, or it could be brain injury later in life if you're involved in an accident, for example. Okay, learning disorders. You can be super bright and have a learning disorder. Some very famous, highly functional people have learning disorders, such as Richard Branson, who's a billionaire. You can divide them into 3: dyslexia, reading difficulties, dyscalculia, math difficulties, and dysgraphia, writing difficulties. Often comorbid with ADHD, twice as prevalent in boys, strong genetic component, may last lifelong. Intervention does help. Okay, so good luck. That's the end of that. I'll see you next week, maybe.